I know from personal experience it can be tough to transition from a student nurse to a professional nurse. I remember when I started my first job in the emergency room, and I sat there twiddling my thumbs because I still had not successfully gotten an IV in, and I was about to hit the ground running. Little did I know that there was such a thing as nurse residencies, and that's why I'm excited to tell you about HCA Healthcare's nurse residency program. This program supports newly graduating nursing students at the early stages of their careers. HCA Healthcare's year-long nurse residency program helps first-year nurses transition from the classroom to working in the field with confidence. Plus, nursing residents get access to a range of opportunities to learn from specialists in various areas, such as ER, critical care ICU, and surgical services. And there's a variety of other great benefits. Learn more today at careers.hcahealthcare.com/residency. Again, that's careers.hcahealthcare.com/residency. HCA Healthcare is an equal opportunity employer.
Welcome to the Nurse Leader Network podcast with your host, Chris Racinos. Wherever you're going on your nurse leader journey, we're here to help you get there.
Welcome, everybody, to the Nurse Leader Network podcast. I'm your host, Chris Racinos, and today we're in for an amazing treat. We have the Executive Director of the ANA California with us today. Welcome, Marketa Houskova.
Thank you so much. Happy to be here. Thank you for the invite.
Yeah, it's great. We've been trying to connect for, I think it's been months and months and months. And I was in a role as the chief nursing executive at Kaiser in the middle of the pandemic, and it just took way too long. But I am so glad that we finally were able to connect. So it's great to have you here. I'd love to start off by just having you share with us your nursing journey. What did it look like? I mean, you're the executive director of an entire state of nurses. And where'd you start off at?
I started off in communistic Czechoslovakia when I finished 4-year nursing school and started my work in med-surg unit for first, I don't know how many months. And then I moved, I did formal training, and I moved into emergency room. And then finally, when a position opened up in I'm sorry for the mess. And when position opened up at ICU unit, and then I worked in OR, I was a nurse anesthetist, and then in recovery room, and then I got myself into America and worked in ICU and also recovery room and PACU. And so I was also involved with disaster relief and emergency systems and disaster relief and planning and disaster response. And in the meantime, I was still involved in politics and policy. I was very involved in politics in Czech Republic. I was offered first internship and then fellowship at the Office of Vice President of the European Parliament in Brussels and in Strasbourg. I was the advisor to city officials in my town where there is still my home in Czech Republic. And so we were trying to change policy and political process and the decision making and do somewhat like shared governance, obviously in democracy, because for 40 years my country didn't have free election, and we were behind the Iron Curtain, and so life was a little bit different than when the revolution came. And so I was part of all of that. So I always knew how crucial, important it is to everybody's lives, because I was part of it and my family lived through it. And my dad was the mayor, elected official in our city. And so I saw how incredibly important politics is. So when I came to America via England and Canada, when I finally made it to America, I was somewhat surprised that my colleagues, fabulous nurses, fabulous experts, and fabulous leaders, how they had absolutely no idea about the political process and political happenings and how important politics is in healthcare and in nursing. And so I always looked for ways how I can get involved. So I volunteer at California campaigns. I was campaign administrator for election campaign to California Assembly. And so this is how I was making my way into the statewide arena. And then when the time came and I finished my double master's degree, I was looking for ways how to get involved fully in politics and policy. And then somebody said, there is this organization in Sacramento and they have their office and you need to look it up. And I think they are involved in policy and politics. And it was the American Nurses Association, California. So I hopped on a Southwest flight. I flew over here, knocked on the door, got to talk to the woman who was sitting there, the previous executive director. She goes, yeah, we don't have money. We cannot really hire you. But if you're going to help and volunteer, come back in January. I was like, okay. So I packed my life in San Diego. I drove to Sacramento. I knocked on the door in February. And she goes, who are you? I was like, I'm here to help you. and so this is how kind of my journey started with ANAC. I knew that for the next year or so, I will not be making any money, so I was living off of my savings. But as life progressed and ANAC started to take a little bit more active role, really in legislation and regulation, the various board of directors saw my value, for which I remain grateful. And so then I was offered the position of government affairs director, then state director, and then in October 2017, the executive director. And that brings me here.
Wow. That is a journey. Yep. And there's some lessons in there, folks. So if you hear, you just keep knocking on doors and you just don't stop knocking on the doors. It sounds like your dad might have been like a huge influence in terms of policy and kind of showing you the importance of it. What would you say to nurses that are listening that don't have that political, reference in their mind in terms of like, why are politics important to healthcare?
I'm so sorry. Something is happening here around my house.
No
and
worries.
So you hear the sirens. So I think it's the fire trucks are coming to our neighborhood. I think that just from the, for firsthand at home at the dinner table, we didn't talk really about anything else but politics. We talked about foreign policy, we talked about domestic policy, and we talked about political systems. That was normal conversation in my family. I don't really remember if we ever discussed anything else. The issue is that we were not allowed to discuss politics, we were not allowed to discuss foreign policy, and we were not allowed to criticize the regime. So what we learned to do is to discuss things very quietly, only inside. You do not talk about things that you discuss outside. When we tried to look for Radio Free Europe or the Voice of America, it was inside our basement trying to find, ham radio and trying to find the waves from West Germany. And so this was my growing up. And so ever since very early age, I knew how important it is. And so I think that once nurses realize what an important role they play in politics or in policy, what an incredible wealth of experience and experts we can offer to the decision makers, where right now in California, not one is a registered nurse. I think that that's where my excitement comes from. Because majority of things that are decided at the California State Capitol somehow has influence on public health or on healthcare, on access to food, access to transportation, quality of living, social determinants of health. And I think that's where we bring our enormous wealth of experience and our transferable skills. And I think when I always, during my presentation, when I'm lucky enough to be somewhere in person and actually talk, I always talk about the amazing skills we already have. We have all of the skills. We just need to learn and appreciate that we just need to turn them around and use them in a different arena. But I am still using my skill set from nursing.
Wow. I'm like sitting here thinking about like my own children and how I have not done a great job of really introducing them to politics. But, I read this, I was reading this article the other day, and it was like kind of mind blowing to me. And it talked about the diversity in our populations. And so when you look at legislators, policymakers, folks in the Senate and whatnot, the overwhelming majority of them are white males over 65 years of age, right? I think they comprise something around 90%. And then when you look at what percent of, white males over 65 comprise the United States, it's like not even 10% or something like that. And so it's interesting to see how huge of a gap there is in terms of policy making and advocating and all of that. And I think you have hit the nail on the head. I was teaching my students the other day, systems and how, something as small as a change that we do at a hospital, how it can impact your entire community in every way, shape, and form. And so you are absolutely correct around, we have exactly what we need to implement policy and make it really generalizable to who it is that, the communities that we're serving. But unfortunately, it's not a huge piece of nursing school. And so I think a lot of people don't have their eyes open to it. Can you walk me?
But also, I think that, my entry into politics was out of necessity because we had to survive the awful regime. And I think that when my first 16 years in California, it was nobody really had to pay attention to politics, except hopefully, people vote. But other than that, life is really stable. And politics, there are these systems and infrastructures and institutions, and they look after the political system. What I think last 4 years taught us, for better or worse, is that if we don't look after the system, for whatever reason, if we don't vote or if we don't hold our political leaders from either party to account, if we don't question, if we don't have the bravery and the ethics to stand up and speak up, what can happen? And I think that the events of the insurgency, or some kind of insurgency at the state capitol from the 7th of January, I think it shows us yet again how important it is to look after our political systems and our political institutions. And I think that now many people actually have that discussion at home, at dinner tables, or on Zoom, since you cannot meet with families. I think that this situation really brought the importance of politics in our everyday lives. It brought it back, and maybe out of that awful experience, something positive can come up, that we focus back again on politics and back again on the importance of institutions and the importance of discourse, but respect on the importance of political debate, because that's where we started and we just need to turn back to it. So I think this is a great opportunity to kind of go back and start to learn again about politics.
It's true. It's true. I don't know that there's anybody who hasn't talked about it or heard about it, right? My son came up to me and he was like, "Mom, do you see what's happening in the Capitol? My, teacher's telling me." And I said, "Yeah, I'm sitting here watching it unfold before my eyes." And so it was a great opportunity to talk to him about it. And I think, even if we had not had that happen, let's say that event had not happened, we're in the middle of a pandemic. We have nurses that don't have PPE. We have nurses that are completely burned out. We are outside of California ratios. We, just all of these different challenges like that in itself would, make me reflect on, as a nurse, have we really done everything we needed to do at that level to ensure that we have what we need to take care of people? And the answer is no, we haven't. So, I think a huge light has switched on, and, we're now looking at the culmination of really not being involved in policy where we, should have had a voice a long time ago. Can you?
I think the example of really underfunded and anemic public health system, in California, or actually throughout the U.S., but especially in California, since this is where we live, I think that's a huge example where nursing or professional public health voices have not been heard or have not been involved in decision making, and have not even been asked to be part of certain decision making, because again, everybody just took public health. Oh, you just get the certification, when you finish BSN, and then, oh yeah, it's just public health, right? I mean, nobody really actually knew what is it that they're doing, and nobody paid attention. But now, with 58 counties in California now tasked, or people look to them with, vaccination strategies, I think that we are now yet again more aware how incredibly important public health is, and how the California administration and the federal administration should really beef up our resources and our response, because nothing could be clearer than COVID-19 2020/2021.
Yeah. How would nurses influence that? How as a body of nursing can we say we need to have public health funded? We need you to hear our voice. What's the first step?
I think the first step is that you have to belong to a professional organization. I think because for individual nurses, and I was individual nurse on ICU floor in Southern California, as an individual without an organization, it is really difficult to get your voice heard. That's why you have variety of professional organizations. For ANA California, we are the affiliate of National American Nurses Association, and we are 501c6, which is a lobbying organization, or we are trade organization that is advancing our common interest. And so since we can influence decision makers, we have a different status in nonprofit. There are plenty of other nursing organizations that are not lobbying organizations, but there are charitable organizations such as foundation. We work and cooperate and share information with all our partners. So just because you don't belong to a lobbying organization, as long as you belong to a professional organization, we try to share information across our membership and across all the different silos for which we are still in nursing very deeply ingrained. And I think that's one of the problems is the silos in nursing. But there are, I think, 57, maybe even more, different nursing organizations just in California.
Wow.
So you can see how not only silos in terms of ICU versus ER and NICU versus, labor and delivery, and then you have this health system and this health system and this hospital and this institution and this clinic, the silos are very deeply ingrained. And so what we are trying to do is to work across the different variety of organizations and trying to share. So all my colleagues, they know that I keep sending them all these emails because I want them then to share it with their members. Because it is really important that we as nurses, we are a highly educated profession. And I don't really see a reason why there is 500,000 of us in California and we don't have a political voice. We really don't have political presence. We don't have political capital. Now, the thing is that when you ask, why is it that we are not part of it? Many times I hear that what I am doing is absolutely wrong because nurses should not be political. Nursing is all about politics. It's all political because it's about decision making. Who has access to care and to what care and when? And so when you realize that it is the state legislators, it is the California State Legislature, it is the California State Assembly and California State Senate that makes decision for healthcare in California. It's not the federal government. They do have, because obviously we know Obamacare was passed, and so there are certain mandates. But then the implementation and the logistics of delivering care, that's all California. So it's the California legislators that are deciding what you can and cannot do in your nursing practice. And the moment I explain this, everybody usually goes, oh my God, I didn't know that. Now I know why I have to pay attention. Because if there is not one nurse out of the 120 legislators, if there are decisions being made about public health and nursing, who makes the decisions? People who know nothing about nursing. And if we think that if we as professional organizations are not there, it's okay, somebody is there. Yeah, somebody is. But do they have professional nursing and nursing best interest at heart, right? Because it's always kind of battle for influence and the arguments you are using and the stories you share. And so where I feel that nursing has enormous leg up is that for 19 consecutive years, we've been ranked by Gallup poll the most ethical and trusted profession. There is 500,000 of us in California, 4.3 million in the United States. That's oh my God, we're the largest employee group in healthcare. And so I think that we should have political capital and we should have the influence and the ability to educate the decision makers on why certain things would help us and would advance the profession and would help public health nursing, but some even maybe well-intended aspects and legislation and bills, they can hurt access to care and profession of nursing and healthcare overall. So I think once nurses realize that it's not abstract, somewhere somebody is making decisions, but it's about us and we have the voice if we choose to use it and if we belong to professional organizations, I think everything changes. because that's where they realize that the power of professional organizations is then at these halls of powers. It's at regulation meetings, it's at legislative coalition meetings, it's at meetings with the governor. And while I appreciate and understand that my colleagues are looking after actual people in the hospitals and in clinics, I have the utmost privilege to lead an organization that is looking after their interest. And so the more people I have, the more members, the more phone calls, the most letters, the more Facebook posts, the stronger digital campaign we can show the elected decision makers, the harder they are listening to us. So if I show up somewhere and I say, while we nurses, we appreciate what you're doing, this is really hurting us. And they look at me and so, how many members called our office? Marketa, 2 members called our office. So clearly, it's not that important for your members. And I'm always trying to explain to them that that's not how it works. We work long shifts, we work extra shifts, we have responsibilities. That is my job to tell you what my members want. And they go, no, we need to hear from our constituents. So that's why I always ask, do you know who your elected official is? Right, look it up. Look up my elected official in California. Put your residential home address and boom, they're right there. It's really important to let them know that you're aware that something is happening, that there is a bill that could help us or could hurt us. It's really important because they keep track. They have a person there who is answering the phones and the person is making notes. How many times people called on what issue? And so then when I show up and try to explain to them how critically important this is, and they go, yeah, but we had 3 people calling in. That's where I think nurses can really help their professional association by being aware and by being engaged. And we are trying to make it really easy. We're trying to create sample letters. We are trying to give talking points. We are trying to pre-fill out different forms and different letters through our digital campaigns. We just need nurses to know how important that is. And I think that's always the number one issue I'm trying to maybe round away right now. I am trying to convey. Thank you for the time.
Yeah, for sure. So are you saying that when we get those sample, I'm sure everybody's gotten them where you have, something that comes in the email and it's like a generic letter and then you just click on, your representatives and you send to it, that has equal weight as picking up the phone and calling them and saying, hey, I want you to listen.
I think that it should not be this or that. It should be this and that. So those nurses who feel comfortable to picking up the phone, because there is always click here, call them, click here, send them an email, click here, follow them on Twitter, click here, post on Facebook. And I think that if each of us, and there is 500,000 of us, if each of us twice connected with our elected officials, whichever way, I think that really would show the power we have. And it really makes them listen to us because they know that there is this vast amount, that there's this huge number of us. And we're very important, we're very influential because we are the most ethical and trusted profession. So we have the platform. We just need to use our voices. And the way we educate our patients inside institutions and clinics, I think that our voices need to be also heard outside the institutions.
Yeah, I agree with you. And, I think I didn't realize how much power you have in your voice, even as, a single voice, until I started advocating for the American Foundation for Suicide Prevention. I advocated for them to have that 3-digit number. And we had been advocating for a couple of years, but we got over the last year really, really impassionate about it. And I think all of our legislators from across the nation heard it because we were able to put that through, right? So now I think it's 2022 or 2023, we'll have our 3-digit number that's similar to 911 where we can call for folks that are in crisis. So I see how that works. And you're so right. I sat here when I graduated nurse practitioner school, and I was thinking about, opening up my own business. And then I saw how difficult it was here in California. And I had friends in Texas and all these other places that had independent practice and opening up their own business. And I realized what is that? What's the difference? And so I started following really closely the California Association of Community Clinics, CCLAC. I started following their work closely, and it was interesting because every single time an independent practitioner law came up for nurse practitioners, it was never written by a nurse. We had optometrists. I mean, we had all kinds of different disciplines, but nurses had never written for it, which was frightening and appalling and scary. And so, we recently just had our bill pass that gave some type of independent practice. Could you share a little bit about what that bill is and how it's impacted California?
Sure. Yeah, it was Assembly Bill 890, and it was authored by Assembly member, the chair of Assembly Health Committee, Jim Wood. He is a dentist, and so I really like to be talking about Jim Wood because he's a kind man. I met with him several times, and I think that his story of how he got educated as to what nurse practitioners, because this bill is focused only on nurse practitioners. So how he got educated about what nurse practitioners do, because there was a previous 4 years back, there was another bill, again, focused on nurse practitioners, and he voted no on that bill back then. The reason he came back in 2019 and he authored and introduced this bill is that he was part of the California Future Healthcare Workforce Commission, which was headed by Grace Napolitano. And there were, I think, 30 or something like that, 30 commissioners who of California and national healthcare. And so they were looking into access to primary care. That report looked at primary care. And so they realized that the looming primary care physician crisis is such that there is actually a category of providers who could help, and that's nurse practitioners. And so the more he was looking into it, the more he was looking into the education, the more he was looking at the quality of patients' outcomes, the more he learned about what nurse practitioners do and how they work. That changed his mind completely from going against full practice authority into actually authoring a bill for nurse practitioners, full practice authority. And so I think that's a fantastic example what you can do with education and with somebody really listening to you when you are sharing data and evidence-based practice. So Jim Wood authored this bill, and while many of the bills were not written by a nurse, but nursing organizations such as California Associations for Nurse Practitioners and us and Health Impact and ACNL and all the other APR and coalition organizations, we all work together. And so we all read the language bills, we all read the amendments, we all were submitting our issues or our arguments or our propositions. So while a nurse didn't write it, our voices were heard and we were part of the process. The issue with that is that this is politics, and politics is all about compromise. So several amendments had to be accepted, and it was a really hard pill to swallow for all of us. But amendments had to be accepted. Otherwise, very strong groups would put barriers for this bill to move forward, and we would end up again with nothing. As of past 25 years, we couldn't get anywhere. This is the first time actually a bill was passed, and so there are some provisions that until starting 1st January 2021, so everybody is grandfathered in, but starting I think 2023, if I remember correctly, there has to be 3 years or 4,600 hours of transition to practice. That's first, and that cannot be part of your previous RN, that cannot be part of your NP training, that has to be additional 4,600 hours. And then you have to be a nurse practitioner in good standing for 3 years. And then, if I remember correctly, BRN is deciding, or BRN will issue another exam, even though nobody understands why. But again, that was one of the amendments that had to be accepted. So then there's going to be another exam at the California BRN, and only then you will be independent nurse practitioner. So those were really difficult amendments, but also I think it's important that we got it passed. It's important that we we saw this legislative success, and then let's see what we can do, next year, what we can do in 2023 when we have more data. We can always come back to the legislator and tell them that, can we change this? Can we improve this? Can we shorten this? Studies show, evidence-based shows, right? Hopefully there is something we can do to make it a little bit easier. But as of today, the law in California is such as it is.
Wow, that's great.
It's not a simple process.
No, it doesn't
passing
sound
a
like
bill
it.
and this complicated. It's really difficult.
What advice do you have for nurses that are in other states that don't have independent practice yet? Like, so they can, start by joining their professional associations. What would they do after they join their professional associations? I know a lot of nurses who join and then every year they pay their dues, and that's literally what it is. Like, they don't go to any conferences, They don't do anything. So what would be your advice once you get into your professional association? Then what's next?
Well, once you join our professional organization or any other professional organization, that each organization, speaking for my organizations, we have various committees. We have legislative committee, nursing practice committee, nursing education committee. And then while committees are great things and there are these long-term activities, we also established plenty of short-term task forces or work groups because, nobody has 2 years to give, to work on a certain issue or cause. So what we can do with the resources we have is to focus on, let's say, writing recommendations or writing a white paper, writing lit review. We're focusing on different things where we can, with our resources, we can use all the knowledge and expertise and experience we have, and something that we can share with other nurses, share with other organizations, and share with the elected officials and the decision makers. So right now we are working on with a work group focused on racism in healthcare. And that's yet another very important thing, while it's not focused necessarily on legislation and regulation, but who knows, it may be part of regulation. It will definitely be part of internal policies and institutions. So these specific issues, topical, interesting issues come up quite often. And so what we do is we share it with all our members. Are you interested in serving on this task force focused on social determinants of health, let's say? Are you interested in working on nursing in long-term facilities? Are you interested in working on we just had a discussion about the technological burnout in EHRs and electronic health records. So we're trying to excite and inspire nurses to be part of these short-term work groups or task forces. And I think that gives them, I guess it opens a little bit the curtain as to what professional organizations do, what we can do, what we cannot do, what we have the resources to do. But we're always trying to make it really exciting. One example was, I think 2 years ago, ANA California was chosen out of all the different 37 state organizations, along with New Jersey State Nurses Association, to be part of a coalition, infection disease coalition with CDC. And so we created a task force, ANAC CDC task force. We created peer-reviewed webinar. Our members were able to present the webinar live to 2,000 people. It was actually uploaded to CDC website. It was on our website. It was on ANA website. It was the most watched webinar in terms of reusing equipment and how to disinfect it or sterilize it. And so then we were invited to scientific research symposium, where we again brought our members and they were presenting. So there are all these different aspects what we can do and how we can make it more exciting. And I think that anytime nurse stands up and starts speaking on behalf of nursing and on behalf of the specialty and on behalf of increasing access to high quality, timely care, that's nursing advocacy. And so that's what we do. And advocacy is our core business. And so we're just trying to make it a little bit more exciting. So, and we have plenty of people trying to get connected with us, so which is absolutely fantastic. And we're just trying to pick interesting topics so people are interested, because after 12-hour shifts, coming home and have to be on a 3-hour Zoom call discussing policy, I don't think we would have people coming back to us.
Yeah. I mean, it sounds like we just have so much ability and we just need to prioritize what is important, right? Because if we aren't liking what we're seeing at the bedside, we have the ability to change it. It's really just about taking that first step. So I'm like totally sold. I mean, I didn't even realize all of the things that the ANA works on. So this has been beyond enlightening for me. What are some of the other strategic priorities that ANA is working on right now? What are some other pieces of, legislation you guys are looking to move or different priorities?
Well, legislation. So California legislature should be back actually in person across the street at the state capitol, but obviously due to COVID, they're still not back. So I think that the first year of a new legislative session, since we just had elections, so we have new people in both houses, in Assembly, 80 people in Assembly and 40 people in Senate. They will start, or they already started, but again, it's virtual and it's via Zoom, and it's really no fun for anybody who is in politics, because there is something very special when you step across the threshold at the state capitol, and all those nurses who attended our RN lobby day here at the state capitol, they know there is something very special when you walk into that building, and then you go and you meet with the legislative staff. They always listen. They want to hear from us because everybody loves a nurse. And when you say, "Oh, hi, I am Marketa. I am a registered nurse, and I live in your district," and first answer you hear, "Oh my God, we love nurses," and then they start to tell you, "My mother is a nurse, and my grandmother is a nurse, and my sister is a nurse, my dad is a nurse." There is always minimum 2 nurses in a family. So everybody is very connected to us. The issue always comes for us actually asking, delivering the ask, what is it that we want? And because everybody knows that nursing is so complicated, they always hear something and they go, "Oh, we get back to you." but just bringing nurses into that building is it always makes me so happy, because by bringing nurses into the building, I always say that we are removing barriers between, elected leaders and nursing leaders, because just by stepping into the building and going into the office and sitting down, and then you realize that it's like this, shabby desk. There are like these 2 young people sitting there, and you're thinking, why was I scared for 3 days? It's just, we are removing barriers. So that's why I love going actually inside that building. But now it's virtual. So lobbyists, usually they have access to, or they call in, oh my God, this is like 1958. They call in like 1-800 number. They call in and they're trying to get to be heard at different committees. Roxanne Gould, our fantastic lobbyist, she was telling me that I think that in July or August last year, she was trying to give our support for specific bill, and I think Senate Health Committee. And so when she called the switchboard, she was number like 382.
Oh my goodness!
And when it finally came to her, so the operator goes, "Okay, you can now talk." And she goes, "But my bill was decided 20 minutes ago." So they didn't even have access to it. And I think that's kind of a problem with virtual government.
Oh.
But it is what it is. We have to do the best. So what we're really doing is focusing on digital advocacy. And so we have different platforms. We have fantastic guy, Jared Fessler, at our office, along with Teresa Manquera. They're fantastic with the member engagement, and Jared is drafting and crafting all the different messages. And so as legislative session will continue, we will have these different, we call it campaigns. It's just these digital platforms, digital campaigns on specific issues that you would be able to go to our website. Right now, there is maybe 1 or 2, but we don't know what bills are introduced yet, because they have until end of February to introduce bills. So that's why it's wait and see. But once we know the priorities that we're going to be working on, we will have these digital campaigns for nursing advocacy. And so you will be able to go to our website, click here, pick what issues you are interested, what you want to be part of, and you can just kind of get involved like that, because that's our 100% focus right now. Since nobody can go anywhere, we cannot even go get a cup of coffee, and there is definitely no meeting. Yeah. So it's from the couch.
It's a new way to do things. You can't get easier access than when it's available to you on the couch. So there's no excuse now.
Exactly. And we are really trying to make it fun and simple and easy. And, Jared constantly talks about trying to do like different gaming, like gaming aspects into it. So it's interesting for nurses and it's fun to do as opposed to, oh my God, it's a drudgery. I have to be part of advocacy. That's completely wrong approach. So we're trying to make it a little bit different and really trying to make it somewhat easier and I guess fun, and yet show how incredibly important your voice is, as we covered at the beginning, because there is somebody at the office and they are marking how many times people call or contact them on specific issues. There is somebody who is actually keeping count.
Yeah, that's interesting. Now, you guys had recently a campaign, or maybe it wasn't called a campaign, but it was around having 10,000 nurses on boards. Yeah. Tell me about that. How did that come to be and what was the results?
Well, actually, it was, oh my God, I think everything was like 2 years ago, but actually it was like 2013, 2014, I think, that an idea came about with ANA strategic goals back then. One of the goals was increasing nursing voices inside and outside facilities. And I actually use this strategy and use this pillar in all my presentations because I think that it stays really important. And one of the things was how can we strengthen nursing voices and nursing presence at decision-making tables? And so one aspect was nurses on boards. So this is how it started inside the nursing community discussion. And it was, I think, ANA was really part of founding ideas. And then out of that became this independent organization called Nurses on Boards Coalition. And so ever since 2015, they were their independent organizations that their whole purpose was to have each representative in each state. So we had, I believe, Mary Dickow from Health Impact in California Action Coalition. She was the California liaison. And so all we had to do is, which was really difficult, but all we have to do is get the nurses who are already serving on boards and coalitions and advisory boards and PTAs and school boards and clinic boards, having them register. I guess again, register their vote. Register their voice that we already have so many nurses. So it was not necessarily about placing nurses, but it was about placing nurses and counting, making sure that we have 10,000 nurses on boards and coalitions. And so yesterday I was reading in one of the updates that we made it, that we achieved it. True, 3 weeks later than 2020. But we managed to place 10,000 and count 10,000 registered nurses on boards and coalitions and PTAs and advisory meetings and advisory groups. Yay!
Tremendous. That is so tremendous. And now we need to go for 100,000 boards.
Absolutely. And I think that we have more. I think that nurses don't even realize that they should go into, what did I say? NursesOnBoardsCoalition.org, and that they should, they should input their information just so we know how many nurses. Because I guarantee you, we as nurses, we serve and help and volunteer in so many organizations and in so many areas, but we never think to brag about it, and we never think to celebrate it because it's like, yeah, that's what you do.
Yeah.
Yes, that's what we do, but we should celebrate it. We should say thank you. We should acknowledge it. And I still don't think that majority of nurses in California actually inputted their information, because if they did, we would have way more than 10,000.
Yeah, I am like totally going to raise my hand because I'm guilty. I serve on a board for a school of healthcare professions, and I did not fill that out because I didn't know about it. So yeah.
See, now you know.
Yeah.
So I wonder, what is the goal that the coalition will do now? Because I think that they will continue because they know how important it is.
Yeah.
And so I'm sure we're going to have another 10,000.
Awesome. That's so great. This has been a fantastic conversation. I mean, you really have brought so much value to our profession, and just kind of highlighting the importance of our voices and how to use our voices, which I think we just don't know how to do. If folks are interested in joining the ANA, where do they find, how do they find us?
Well, you can go to our website, ANA California, one word spelled out, anacalifornia.org, and then there is Join Us. And one of the advantages with ANA is that since we are an affiliate of the national ANA, the one low monthly fee, it kind of gives you access to the resources and to the activities and efforts of both organizations, because we are independent organization from ANA, but obviously we work very closely. We are the state affiliate and they are the national organization, so we work on different things, but you have access to both. And national ANA is doing amazing things on much larger and national scale, for which we obviously cannot do. And so I use their resources. I use their white papers and their policy papers. I use it all the time. I use it as citation and I use it in my presentation. So when you come to our website and click Join Us, it will bring you to the central database, which is thankfully operated by ANA. So you get, I think right away, you get access to both organizations, and then you will receive email from ANA and then email from us where we're welcoming you. We give you login into our website and into the membership materials, and you're good to go.
And for those that are listening outside of California, is there affiliates in all of the different states, or is there some states that don't? There is?
I think it's like 40 or 39 or 40. Absolutely. Just look it up. Sometimes it's ANA Idaho, ANA Michigan, ANA Illinois. So just look it up, because for all those not living in California, yes, all the major states, they all have it. Yeah.
And then are folks that live outside the country able to join ANA, or do you have to live in the U.S.?
I don't think you have to live in, but you have to have, for us, for California, you have to have California RN license. Okay. But there are plenty of people who live abroad and who keep their original licenses. So I also have a license. My original license is from Colorado. And so I do keep both licenses. And so I have access to both organizations.
Okay, great. And Marketa, if folks want to reach out to you just to kind of get to know you better, or, contact you for whatever reasons, how can they reach you?
Well, you can reach me at my email, which is Executive Director, at anacalifornia.org. We picked our domain very easily. Or you can reach to our office. Teresa is at the end of the phone call, which is 916-346-4590, or ANAC at anacalifornia.org. We want to hear from you. And if you are our member or you are not our members, we always talk, we always listen. We never send anybody to trash in the voicemail or in the email. We always respond. Sometimes it takes us a little bit longer, but we do respond. So we want to hear from you.
Awesome. This has been fantastic. I've had a great time. Thank you so much.
Thank you. I really appreciate your time, and thank you so much for listening.
Awesome. Okay, so I'll stop the recording. Okay.
So how was it?
It was great. Oh my gosh, you had so much really great information.
Sure. Okay.
Yeah, this is great.
Because sitting here on my couch with my nice top and sweatpants.
Yeah, no, this was awesome. This was really, really good. So I totally appreciate it. I'll go ahead and I will get this edited, and then we'll have it. I'll send you the copy of it. And then if you could send me a picture so I can use it in the promotional materials. Sure. And then I'll send it over to Jared so he can put it on the ANA website too.
Yeah. So usually after each of interview or each recording, then I call him and I say, "Oh my God, I was talking way too long and I was laughing stupidly." You stupid jokes.
Let me tell you something. When my listeners tune in, they are not tuning in to hear me. They're tuning in to hear my guests. Yeah. And so it's an expectation that my guests speak way more than I do, because you guys are the reasons that I have you on, right? You have the information. Yeah. I don't have it. I just facilitate sucking the information out, but I'm definitely not the one that has it. So,
no, this is great. Chris, thank you so much. I so appreciate the invitation. It means a lot. So thank you.
Yeah. Thank you so much for coming on. I really appreciate it. I know you're a very busy woman. I can hear it. So this has been really
And
great.
so you know how to get in contact with us, because even if you email Jared or Teresa, we are constantly in contact. So if there is anything where we can help you, anything you're working on and you need our help, we're always here. So please let us know how we can, help you and assist you in your efforts.
Yeah, for sure. I mean, me and Jared have talked several times.
Yeah.
So he's a cool guy. I like him. But
Yeah, me too. Me too.
Awesome. Okay. Well, you have my contact info too. So if you need anything, let me know. This has been really great. And like I said, I'll let you know when everything's going to come out, and just send me that picture.
Perfect. Thank you so much. I so appreciate it.
Okay,
Bye.
bye.
Bye. Bye.